So for lower extremity, for hip and knee flexion, for hip flexion we tend to combine that with knee flexion. So what I will do again, can you scoot closer to me? Again, you always want your patient as close to you as possible. You want to support the foot with one hand and the thigh with this hand, and we'll come up into hip flexion and then back down. Flex and back down. A lot of times the weight of gravity will pull the leg down into extension, and your hands are just kind of slowing that effect. That's how we do combined hip and knee flexion. When we're doing hip extension, go ahead and roll onto your right side for me. And can you scoot towards me? Good. Alright, so I'm going to flex her knee here. Just like her elbow, I'm going to cup and scoop that leg. Hold it right here. And then I'm just going to rotate my body and move her back into the hip extension that she has. You're very limited. And come to there. I'm watching the alignment of her body and making sure that her trunk doesn't buck forward into a lot of flexion. When I come into that extension, that would indicate we have some hip flexor tightness, which I think we do right there. And that's how you do hip hyperextension. Go ahead and straighten that out. Okay. Roll back onto your back for me. If I just want to elongate my hamstring, if I want to focus on just the hip and not the knee, I'll keep the knee straight. And raise her up. And then back down. But again, in general, we tend to combine hip flexion with knee flexion. If we want to do hip abduction, we're going to support underneath the ankle. And I'm going to wrap my hand around the inside of the thigh and support underneath. And again, I'm just going to turn my body out and move us out into hip abduction. For hip internal and external rotation, we will flex up to 90 degrees at the hip. I'm going to scoop, going to let my elbow support, have my hand here, and I can externally rotate and internally rotate. Externally rotate and internally rotate. I got those backwards. This is in hip internal rotation because the foot goes out, and this is hip external rotation because the foot goes in. Let the leg go down. Can you rotate? Put your head down there, swap places. You okay? Alright, so for ankle dorsiflexion and plantar flexion, I'm going to support underneath the ankle. I'm going to kind of grasp our calcaneus here and our talus, and plantar flex, dorsiflex, and then plantar flex. I'm going to use my forearm along her foot to support the foot and produce the movement. Okay.